Fitbits, they keep track of our steps. Weight loss apps help us stay on point with our diets, and telemedicine brings the doctor straight to you. So technology, of course, changing the way we monitor our health. And Olivia, it's also pushing companies to improve health care and health outcomes as well.
That's right, and it's not just health companies getting involved. Even Facebook is the most recent tech giant to launch a healthcare initiative as part of its mobile app. So what do we really think about all of this? We're bringing in Dr. Sharon Thompson this morning, our health and wellness expert, to kind of break down some of the benefits of all of this technology and maybe some of the pitfalls we need to be aware of as well.
It's amazing what computers and data has allowed us to do in terms of tracking our health care. We talked about Fitbits and the Apple Watches that are sort of ubiquitous these days, and helping folks keep health top of mind.
Okay.
And I think that's a huge pro of all this new technology. I tell a story about a friend's daughter who her mom was concerned about her weight. She got her an Apple Watch and that was the end of the problem.
You're kidding.
She started working out and being active every single day, because I don't know about Fitbits. I have an Apple Watch myself, and it has little rings that tells you about your activity. And that becomes a goal. You just become, you want to get those rings closed. And that's great. That's fantastic. I think it also, some of these tools can help remind you about your preventative health screenings.
Okay.
And that's actually what Facebook has launched. So basically it's an icon that you can click on in the mobile app, and it will tell you, you put in your age, you put in your sex, male or female, and it tells you, are you due for a mammogram?
Okay.
Are you due for a pap smear? What heart screening should you be having? And I think that's hugely helpful to consumers.
Because it is easy to go, wait a second, when was the last time I was in for a fill in the blank? And those reminders can be lost, or you know, if you don't book because it seems like, oh, it's a year out. It's silly. I always say, oh, I don't want to book yet, I'll call. Well, then you don't call. So.
Exactly. And some screenings are every 5 years or every 10 years, and it's so easy to lose track of those. So I think that those things are very helpful to help you stay on track for your screening, to help you keep health top of mind, to help you connect with your doctor. If you have hypertension, let's say, you could take your blood pressure home and push that to your doctor's office remotely. And so tools like that are so helpful for decreasing the barriers to healthcare.
You mentioned up at the top telemedicine, and I mean, obviously nothing probably can compete with the face-to-face and an actual physical exam and all of the signs that something might be wrong. But that's a really great, I mean, it seems to be a great tool for those who are able to use it.
Definitely. And if you think about the entire country, there are areas where there are not major medical centers, where you might not have the specialists that you need. And so you can combine telemedicine, where sort of the doctor is sort of Skyping or FaceTiming you, right? And you have a provider who is able to do the exam with you.
Okay.
They don't necessarily have to be the specialist, and they can be directed by that specialist to give you that combination to get the care that you need. So we can really use these tools very creatively to bring care to people who might not have it.
Let's talk about some of the risks of all of this. One of the things is, you know, you say a little bit of knowledge can sometimes be quite detrimental. I mean, you know, I'm sure you get it all the time of, oh, well, I looked this up on WebMD, and so therefore I know this, or my Apple Watch told me this, right? So I don't really need to see a doctor because I've already got it figured out.
Yes, and that is definitely a problem. You've keyed into one of my peeves here.
I can only imagine.
And one of the other issues is that you can get caught up on a number when the number really isn't important. The number might be true, but not really important for your health. So I think that's a pitfall. And also, this can raise some issues of access. So for example, Apple introduced a few years ago that they can monitor your heart rate and give you alerts. And it's going to give a lot more alerts than people who actually have problems. And now all those people need appointments and might crowd out the people who actually have a problem.
And make you feel anxious about something that's not really a worry.
We have to figure out how to refine these tools so that they really give you useful information. We're not there yet because we're at the beginning of this technology. Another big concern is privacy. Yeah, so medical doctors and hospitals are held to a high standard for patient information, how they secure it, what they do with it. And these private companies may not be held to such a high standard. So you really have to be careful about the kind of information that you allow them to have.
First thing I thought of when I heard that Facebook edition, I thought they already know too much about me as it is.
And they can naturally your location. They can, they have a lot of power.
Dr. T, we appreciate you so much. Central Phoenix Obstetrics and Gynecology. Thank you. Good to see you.